and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Now, tonight on the show, we're going to be looking at the question of whether nation-states have a duty to prevent infectious disease outbreaks from spreading beyond their borders. Now, to help us think through this question, we have on the line Sara Davies, Professor in International Relations at the Centre for Governance and Public Policy at Griffith University in Australia. She is the author of the recently published book, containing Contagion, the politics of disease outbreaks in Southeast Asia. Sarah, welcome to the show. Good to have you on today. Now, I understand the book was published in 2019 before the COVID-19 pandemic, but talk to us a little bit about your research, because it drew on how Southeast Asia had responded to infectious disease outbreaks ranging from Nipah and SARS and the avian flu to dengue and Japanese encephalitis. So all the research from the book, Sarah, how is that informing the way you're watching the developments of the COVID situation right now?
Thanks so much for having me. The things that I'm looking at in the outbreak at the moment in the region is the degree of cooperation amongst the states. One of the things in the book that I argue that was really important about this region was that awareness that states couldn't manage these outbreaks on their own. We talk a lot about states with different health system capacities and different types of political regimes, and can they really cooperate when they've got such marked differences? What I argue in this book is that they can, and in fact that these emergencies drive that impulse to kind of just lock down and deal with it on your own. It almost drives that away. And on top of that, this region has been very proactive in sort of trying to make sure that that impulse to just lock down, manage it on your own, doesn't happen. Because there is that awareness through those outbreaks that you've mentioned of this deep interconnectedness, that if you don't manage the outbreak through good communication and sharing what practices you're doing in a domestic level, it really can impact and harm the broader region. And I think it's significant that this region has tried to have this conversation and talk about preparedness in a lot more proactive way over the last decade. It's not perfect, but I think it's important.
So what mechanisms on a regional level are there that are actually now operating, that have been catalyzed into taking action?
What I think has been really interesting about the Association for Southeast Asian Nations has been the way in which that regional organisation has been part of discussions around infectious disease outbreaks for now about 15 or so years. And I think that's quite important. And we're seeing that the benefit of that come into practice now. So the World Health Organization within the region, its Western Pacific Regional Office and Southeast Asia Regional Office, have been trying to work together for a number of years now, and ASEAN was always brought into those discussions. And what we're seeing happen at the moment is ASEAN is still working with the World Health Organization. They're working with China and the +3, ASEAN +3 mechanisms. They're working and talking with the United States, but what they're also doing is talking together. So you've got the ASEAN Coordinating Council, which is basically the composition of foreign ministers that have been meeting since February, and then meeting again in April. And then you've got all these additional acronyms, but they're really important. So, you've got the ASEAN Public Health Emergency Operations Centre, for example, which is, sharing testing and mortalities and cases around the region on a daily basis.
Okay.
And so that means that there's lots of information that's flowing around in the region, and that's really important.
Okay. So, Sarah, you talk about this cooperation, but there are critics out there who say that ASEAN has actually been quite sluggish in developing a regional response to COVID-19, instead adopting what they describe as a nation-first mentality. Would you agree with those critics?
I think what we've seen is the region go through the shock. And in the first couple of months, you did see the shock. You saw the border lockdown. And I think that is representative of what you've seen a lot of countries around the world do to various degrees.
Right.
So there's that instant reaction, that position of lockdown, isolate, contain and control. Right. And then you see this gradual realization that there has to be some sort of mechanism then to re-establish coordination Things like food security, economic security, even sharing information around testing and responses to flattening the curve requires that sharing of information. So while it's disappointing that we've seen a lot of regions actually do that, I don't at the same time think that we can necessarily criticise or say that one group has been worse than another, because it's something that we have seen replicated around the world actually.
So, Sarah, sorry to interrupt you. So you talked about the region in shock at first, but I'm just wondering, because this region, because Southeast Asia has had to deal with SARS, with the avian influenza outbreaks, does the shock still apply? I mean, shouldn't these countries kick into gear a lot faster?
So I'd say some of them have. And we can certainly see, but if you look down at the number of the countries that they're testing, you can see that some have certainly kicked into action a lot sooner. If you're talking about whether or not they should have collectively worked together sooner, so some individual countries have responded very fast, some haven't. I think we all knew that that was going to be a problem. There's been some countries where it's been a little bit of a surprise to see that there's been a little bit of a slower reaction than what perhaps we thought there would have been. But you've got to take into account in some countries their size and the politics. So one of the things that's also really important to note is that the region is trying to now, I think, really aggressively pursue a more coordinated response, which I would say is the most important thing to focus on now. And in terms of could they have done better because they've had these past experiences, I suppose for me the argument I would make is that actually they could have done much worse. And I think that...
Yeah, I think these are arguments that are often also made by our politicians, that we could do so much worse. But I want to ask you about the reality of porous borders within the region. So while the responses might be nation-based, based on the idea that, you know, somehow you can close your borders, we know that many of the borders between ASEAN nation states are porous, and that complicates matters. Have you looked at that issue?
I haven't looked at that in relation to COVID at the moment, but I knew that that was always a very important issue in relation to how we thought about cooperation in past outbreaks. And there was a lot of focus actually in the past around trying to make sure that states with shared borders had a lot more informal communication methods between them to make sure that there were these contacts on the ground, keeping in contact and making sure that there was a good flow of communication. I think that's why it's been important, for example, to see that we've seen the ASEAN Intergovernmental Commission on Human Rights talk about in quite strong words about the need to focus on the fact that there may be populations who are caught in the middle in some of these situations due to migration or due to their location in relation to whether or not they're stateless or not. And there is a need to focus on those populations and think about how coordination can be improved to make sure that no populations fall through the gap.
Sarah, we've got so many things to touch on. We're going to take a quick break. We're going to ask you to stay on the line. We'll continue this conversation in just a few minutes. Stay with us on Consider This. Hello, you're watching Consider This. I'm Melisa Idris. With me, Sharaad Kuttan. We're speaking to Sara Davies, author of the book Contagion, The Politics of Disease Outbreaks in Southeast Asia. Now, Sarah, I want to take a look at the regional response or country-specific responses to COVID-19. What has been your general impressions of the Malaysian response to this public health crisis? And how does that compare, in your opinion, to other ASEAN members?
Malaysia, it's important to note, has been a key part of some of the coordinating responses to this outbreak at the moment. For example, they are chairing the ASEAN Plus 3 Field Epidemiology Training Network. And I think they are also part of the Risk Assessment and Risk Communication Centre in relation to this outbreak. So they're having an important coordinating role in terms of making sure that information and best practice is shared across the region. There's also been issues, of course, in their response to the domestic level about trying to manage, you know, the need for people to come together for religious ceremonies and to feel like they are still able to pursue their, you know, their important cultural and religious beliefs and practices. But there's also that sometimes having to then manage that with the isolation or the lockdown procedures that need, and the social distancing that needs to be put in practice. So I would say that the types of issues that they're having in relation to this are ones that we're seeing many countries experience at the moment. In terms of the testing regime, it seems to be managing quite well. There has been contention, I know, around some of the flow of individuals across the Singapore-Malaysia border and these sorts of things. But again, I think in the scheme of things, what is good to see is that there is discussions about how it's being managed, and there's an attempt to try and make sure that there is a free flow of communication, because we know that communication and information is really important with these types of outbreaks, as well, of course, as making sure there's clear testing regimes.
Sara, in terms of the country-specific responses, have any countries surprised you either in a positive way or in a negative way in this particular crisis?
I think what has been really important to see with, taking into account, for example, Indonesia. It's a very large country. It has a number of regions, and it has a federal system, and it's trying to manage a number of different areas that have different degrees of being affected or likely to be affected by this outbreak. There was, I think we could all agree in the beginning of March, a lot of concern about whether or not the central government was upscaling, the need to make sure that testing and information was being distributed around the archipelago, and indeed that it was able to race ahead of things like, infodemics, which is becoming a big problem, I think, across the region. Trying to control the information and make sure that everyone can access verified information is very important. But I think we've seen an effort since then to try and scale that up. I think we're also seeing at the same time a lot of discussion in the region about how to manage the need to ensure that lockdowns and social distancing and information is managed in a way that is accurate and verifiable and people follow through the procedure, but they're certainly not placed at physical risk or threatened with violence or arrest. And I think those are the sorts of things that, we need to be watching for in some countries, because that can undermine the message around this being a public health measure and just to keep people safe when then people don't feel safe in these environments. So it's a very careful balance.
Can I interject? In terms of Indonesia, we know the media loves success stories, and Bali has apparently come out as a success story in terms of the provinces of Indonesia. Vietnam is seen as a success story. How do you rate the media's sense of what is a success story and not a success story in the region?
So I would say that first of all, there needs to be an effort to make sure that they're looking at testing. So a lot of the focus tends to be on mortalities and have mortality stay down. And indeed, that's a good indicator. But I also think it's really important to look at your testing and do we see a high volume of testing taking place. And another measure that I think is important that perhaps the media doesn't look at maybe as much, or sometimes does and sometimes doesn't, is the degree to which populations at risk are being able to be catered for in this outbreak. So are we absolutely sure that there is a flow of information that people are receiving and that people are getting access? So what we've seen in Indonesia, for example, is a lot of discussion about the important role of civil society groups making sure that there is information and mild, protective equipment, hand sanitizer and masks are available. Right. And so I think those sorts of measures and focus on those are really important as well, because they're an indication as well that people are being able to get out and promote practices that individuals can take on for themselves.
Well, on that note, Sara, in your book you argue that the concerns over cost to civil liberties and democratic practices are even more pronounced today than they were a decade ago. And I want to ask you about, in the different countries that you're watching, whether regime type matters in the politics of disease control.
Well, the cases that you mentioned just then, so we see Vietnam is doing a very impressive job in managing this outbreak, which is, and if we compare that, say, to Philippines, if we look at it in terms of the way in which we think about regimes and which we identify as democratic and which we don't, I think we could say that at the moment Vietnam seems to be managing the outbreak quite well, and we can see that Philippines is struggling, and indeed there's a lot of discussion about how that regime is managing the outbreak at the moment. I don't want to dismiss the important work that's being done by civil servants and civil society organisations in the Philippines. They're doing a very impressive job, but I think it also points to the importance of not losing focus about the importance of regimes and how leadership manages responses to these outbreaks. But I also think it indicates as well that maybe stable regimes and thinking about whether or not democratic or non-democratic regimes can effectively manage risk communication. In my book, I was a little bit concerned about whether or not non-democratic regimes can manage risk communication very well. Can they get bad news sometimes out to populations and help populations self-manage, the risk?
Right.
And this outbreak, I think we're seeing, some challenges to my assumptions there. And I'm happy to own that and then have a think about what that means. I mean, I think what we're seeing is the importance of regimes, regardless sometimes of their political makeup, responding fast and responding openly. Okay. And the assumption that democratic regimes do that better is, I think, in the balance still relatively held up if we look at this at a global level, but I think in this region we are seeing some very interesting variations. And some regimes do seem to manage the risk communication, the testing regime, even the lockdown in ways that don't completely erode human rights. But we also know that there's still a bit more work to be done in this space, and we need to
Sara,
be vigilant.
All right, we have about half a minute left before we go to the break. Tell us, what countries are we not watching carefully enough? Laos is never talked about, Brunei's never talked about, because Myanmar is a huge issue. Tell us, where would you be looking at more concertedly?
I think we need to really keep an eye on Myanmar in the sense that because it is a very large country and there are a number of different ways in which the virus can spread into its borders, it's clear that we're seeing a very determined effort there to try and make sure that it doesn't spread. We've also got to keep an eye, I would say, on Cambodia and Laos. I think there's very good reasons to be looking at those areas. And then, of course, so countries that have that kind of border flow where there could be any potential risk. We also need to keep an eye on your irregular migrant populations and make sure that there are opportunities for them to safely come and receive health care. That's really vital in this instance because we don't want to have populations fearful of seeking testing.
For sure. All right, Sara, we're going to take a quick break. More with Sara Davies in just a few minutes. Stay tuned to consider this. Thank you for staying with Sharaad and I on Consider This. Let's continue our conversation with Sara Davies about health security in the ASEAN region, of which she explores more deeply in her book, Contagion, The Politics of Disease Outbreaks in Southeast Asia. All right, Sara, let's talk a little bit about where we go from here. When a disease is eventually found or developed, hopefully. A vaccine, excuse me. When a vaccine is eventually developed, what mechanisms are available to us to ensure that there is equitable distribution of the vaccine? And what are the realities of the diplomacy of disease that perhaps may hinder that equitable distribution?
Organisation held the World Health Assembly in May, and we've heard already support, and this region was one of those that also included in that discussion around the need to ensure and think about developing an equitable system for producing the vaccine and supplying the vaccine when the vaccine, or if hopefully the vaccine is able to be successfully found and distributed. There is a need definitely to be able to start thinking about populations most at risk, populations that need, and this will be work that's already being done in this region. There is no doubt also the need for the region to be thinking about how it's engaging with the partners that are most likely to be important in terms of discovery and distribution. So we're thinking here already at the moment, we have about over 100 vaccines, I think, that are currently being tested and trialled at the moment. the vast majority of them at the moment seem to be located or supported, financed primarily from your traditional pharmaceutical type companies that are located in, global north countries. So there is definitely a need, and CEPI in particular has been thinking a lot about how to make sure that the distribution run, the production and the supply is not held only by those small number of elite countries, but it is fair, it's equitable, and it's distributed. And this region has already been doing a fair bit of work around this in the area of influenza. So we already have frameworks in the region where there already has been discussions and thinking about how to try and upscale vaccine supply in other instances. So it's not that we're starting from scratch here. We do have frameworks and mechanisms already in place that can be used to then thinking about it in this case.
Sarah, what about the question of the economic health, the relative economic heft of the various member states of ASEAN, especially when we don't at this point know how much vaccines will cost? And, different governments also have different relationships to the idea of, generic drugs and, fighting big pharma on that front. What do you see happening in terms of that dynamic?
Important that ASEAN works collectively in this area with the diplomacy around the vaccine. And it's going to sometimes require a fair amount of internal discussion, like you said, about how different countries feel around their positions around generics. I think what we're also seeing with this instance, and it's been quite interesting to watch the vaccine debate happen already, but there seems to be already quite a degree of acceptance that this is a public good. And what that means then, that in terms of intellectual property, in terms of about thinking about whether or not it can be developed as a generic and how it gets distributed, there is this sense, and if you look through the World Health Assembly discussion around this, there already is this discussion and movement towards the need to make sure that the vaccine can be produced safely, but it also can be produced by multiple partners in multiple locations to make sure that it can get that distribution. And therefore, we don't have these debates or hold up in production and supply because of issues around intellectual property or generic use or not. I think the biggest problem we're going to have perhaps in the region and in other places is uptake. Okay. So it's one thing to say that the vaccine is available, but we also need to make sure that populations know that they can receive the vaccine. It's safe to receive the vaccine. There may be some populations who are prioritised in accessing the vaccine. That doesn't mean that other populations won't get access to it. So it's about making sure that everyone is informed on, and this is very much the responsibility of countries then, to make sure that there is communication around vaccine distribution. It's very clear. There's a staged plan for who gets access. And there is going to need to be discussion. You talked about cost. There is going to have to be a serious discussion here about distribution and cost burden. Who's going to take the cost?
In the meantime, until a vaccine is developed and as lockdowns are eased and economies open up, the use of technology for contact tracing, for tracking whereabouts, that's the option right now. I mean, how do you think we should be watching out for the surveillance of and also the reporting on the use of data for these tracking apps and so on within Southeast Asia?
So we talked about earlier about regimes and human rights, and I think this is perhaps where we really start to see the rubber hit the road, if you like. The degree of will and trust that populations have in these types of apps requires a fair degree of trust in the government system. Now, there are some systems where populations don't have a choice, and they just have to adopt these apps. They're there, they have to have them on their phone, they don't have a choice. There are other countries where there is that free will to choose. One of the things that has been discussed a lot about is how much information governments do actually need in this app. Do they need to know personal details about individuals? How long should they hold the data? And who can have access to the data and for how long? And so I think it would be really beneficial, actually, for there to be more discussion about this. It's interesting to me to see that in the ASEAN April statement, April and 14th of April statement, There was a discussion there about information and access to information, and I definitely think applications and the use of tracing, contact tracing, needs to be discussed a lot more, and it would be interesting to see a group within ASEAN come together and talk about this more, because there is a need definitely to use big data, to think about how it can be used to ensure best contact tracing methods, but we also need to have best practices applied as well.
Sarah, thank you so much for speaking with us tonight. Such an informative discussion. We really appreciate your time and for you sharing your insights with us. That's all the time we have for you tonight on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for this evening.
Thank you so much for watching, and good night.